Great. I'm going to talk about health policy and budget policy, or health policy is budget policy, and budget policy is health policy. This is sort of the agenda, the issues I want to go over, and I want to just quickly say how healthcare spending, sort of an overview of where we're spending money, how we're spending money, entitlements, health entitlements in the context of overall government spending. Focus on sort of these three programs: Medicare, the ACA, and Medicaid. Who and what they cover, how they're funded, how they pay, how they interact, and sometimes people are in more than one program or they change between programs. And then in the mix of that, sort of challenges of making projections and analyses, why healthcare is different than other entitlements in a lot of ways. And then how and why healthcare is changing, which is partly why making those projections is so difficult. We talk about the healthcare system, right? Everybody talks about the healthcare system. It's really not a system. I like to think of it as a group of overlapping things. Sometimes people think of the delivery system as the healthcare system. Medicare is not a healthcare delivery system, it's a healthcare financing system. There's also public health and research. The four are very integrated. Primarily, we're going to talk about financing though tonight, because that's kind of the class. That's what it's about. So where does the U.S. healthcare spending go to? Actually, at like 5:30, I put it on the slide. This is my computer, not on the flash drive. But does anybody know how much we spend for healthcare in this country? Any guesses? $1 billion? More? $1 trillion? Come on, somebody take a guess. You eating the peppermint patty. Take a guess.
$4 billion.
4 billion? 3 trillion. It was a little over 3 trillion in 2014, so it was, I don't know, we'll say 3.1 trillion in 2015, a little bit more. But the point of this pie chart is about a third in hospitals, about a third in physicians and other professional services, and then about a third everything else. It's interesting, you hear a lot of rhetoric, people talk about, oh, we spend 30% on administration. Yeah, it's only about 8%. Or prescription drugs are like, 45% of what we spend on healthcare. Yeah, retail, it's about 10%. There's maybe another 1 or 2% that gets delivered in hospitals and doctors' offices that is different than that 10%. Where do that $3 trillion come from? I put in sort of different colors here. Oh, it doesn't show up right there. Medicare is about 22%. Medicaid is about 18% split between federal and state. VA is 2%, DOD 1%. State public health is about 2%. All the other sort of this ugly mustard yellow, that's sort of private individual spending. That's how it's split between government and private sector. You guys have talked about mandatory spending versus discretionary spending. This is from the CBO baseline report that came out in January. Mandatory spending, 2016-ish, it's about 12% of GDP. Discretionary spending down here, and then net interest, which I often think of as mandatory, I guess maybe not, is down here at the bottom. And then if you break it down further, major healthcare programs, which are all mandatory, that's Medicare, Medicaid, the children's program, subsidy for ACA, and some related things, are up here, sort of the biggest category. Social Security, another big chunk of mandatory. Net interest, other mandatory, and then non-defense discretionary, defense discretionary. So this is why health policy is budget policy. It's just a big chunk of government spending in the mandatory category. And look at it another way, Medicare is about 14% of the whole federal budget. Social Security, defense, and so this is why when people talk about other pieces of things you want to spend more or less on, a lot of the fights on spending more, spending less, tends to be in this non-defense discretionary world. There's all sorts in that non-defense discretionary, there's all sorts of other health programs I'm not going to talk about. We could have an entire 14-week class on health budgeting and health programs. Tax issues, Indian Health Service, the VA, all these other things, clinics, tax deductibility of health insurance costs. So I've alluded to it a little bit before, but why is health budgeting for health programs different from other mandatory entitlement programs? Anybody want to take a guess why these healthcare mandatory programs are different than other mandatory programs in the federal government in terms of their budgeting and spending? What do all three of these have in common? These are all mandatory or entitlement programs. Interest payments on the debt, Social Security and SNAP is Supplemental Nutrition Assistance Program. It used to be called food stamps. You know what they all have in common? If you want to take a wild guess, there's no wrong answers.
You can estimate the costs.
How can you estimate the costs?
Just by knowing the number of individuals that are eligible or that are going to be eligible for Social Security, you would know number of children, childbirth, and I would think.
So it's the number of people, and what else?
Times the dollars.
The number of people, number of dollars per person equals the dollars. It's a pretty simple formula, and the thing about all these is there's not much variation. The interest on the debt is the number of debt instruments times the average interest rate that you have to pay. Social Security, number of people times the average Social Security payment. SNAP, number of people times the benefit they get. It doesn't change all that much. I think it goes up and down a little bit, number of people a little bit, but interest, Social Security doesn't change all that dramatically that quickly. Healthcare, as we'll talk about, and what talked a little bit about how healthcare is changing, we'll get to. Healthcare has spending effects, many more factors, much more volatile, much less constrained by just the number of people and a relatively fixed dollar amount, relatively fixed number of people. What do factors affect health spending? Sorry, I got a little animation here. It's the number of people, but people age into Medicare. Their eligibility can go from one program to another. Medicaid enrollment, it's a counter-cyclical program. Is that any economists in the room besides Barry? Economy, there you go. What's counter-cyclical? Way in the back.
When the economy is doing bad, then eligibility for Medicaid and things like SNAP as well go up.
Right. More poor people, more enrollment, better economy, less poor people, less people in Medicaid and SNAP. But also enrollment. There's currently 3 million people who are eligible for Medicaid. They're not enrolled under every state program. What's the spending per person? The benefits and the coverage can change. Is this covered or this is not covered? There's all sorts of things in the political rhetoric that they talk about should or shouldn't be covered. I won't go into that. But also what specific for those things are covered, what's the cost sharing, what's the utilization and intensity of services, you know, do you need surgery, do you get surgery, are there waiting lists, and what's the price? There's been a lot of things about healthcare prices in the news recently, the last few years. What else affects those factors? The demographics, aging of the population, areas, legislation and regulations can change what's covered, what's not covered, how much is paid. Specific diseases, what's the latest one? Zika. What was the one before that? Ebola. What was the one before that? SARS. What was the one before that? Or no, MRSA. Then SARS. So they didn't have infectious diseases, but Alzheimer's, that's sort of creeping up on everybody. Is healthcare organized to deliver efficient care, inefficient? And technology. Because of all that diversity, and unlike Social Security or some debt or even SNAP, healthcare spending per person is spread out in a very strange curve. Basically, what this stacks up the number of people versus health spending, and that red and black bar on the left is the red and black bar on the right. So about 5% of the population equals 50% of the spending. And looking at it the other way, the yellow bar, this 50% represents about 3%. So the healthiest 3%, healthiest 50% use about 3% of spending. Another way to look at it is this is percentage total, and this is number of people total. Is you've got the healthy people down here, and that, you know, little percent, this is a sort of a distribution graph. This very, very expensive percentage of people, number of people, use most of the healthcare spending. And actually, I didn't draw that curve quite swooping enough. It's even more higher and more smushed in. Something to keep in mind, and this is total health spending for the U.S. Every sort of group you look at, if you look at just Medicare, if you look at Medicaid, you look at employed people, unemployed people, they're going to have a similar distribution. The absolute dollar amount average per person may change, but the distribution is pretty much the same.